Hi, welcome to my YouTube channel. This is Florination and my name is Florence Odhiambo. I'm a special needs and rehabilitation consultant. And so today we are in a different setup. We are at a physiotherapy center. We want to show you the treatments, the medications. We want you to go through also with us the whatever they do, the activities they do, everything. So without further ado, we'll go straight to the doctor. Harry,
Yeah,
how are you?
fine, thank you.
So kindly introduce yourself.
I'm Mr. Mkabu. I'm a senior physiotherapist.
Okay.
Now here at Betterstream, we run the services. Yeah.
So what is this treatment called?
This is an elderly patient. We do geriatric care. Geriatric is care we give to elderly patients whose body, bones, muscles, and are wearing off because of age. So to try and rejuvenate so that we restore joint mobility and function, there are some specialized therapy we give them. Yeah, so this is called sling suspension therapy, where we use slings and pulleys.
Okay.
Ideally, I want to use some weights on her.
Okay.
So I cannot give an elderly patient weights to carry like in the gym.
Yes.
But indirectly through this, is doing weights without knowing.
Nice.
Yeah, so we strengthen the muscles and the joints.
Nice.
Yes.
So this helps on the muscle and joints only, or it?
We are doing a generalized body mobilization exercises. But now we have reached a stage of strengthening. When you see any exercise that involves weights, just know these people are looking for strength. Yeah.
Okay.
Yeah.
Does it calm nerve pains?
After therapy is in stages. So we have done something before coming here.
Yeah.
We have done some stretches, to prepare the body for this.
Yes.
Yeah. So when you do some stretches in a patient who is continuously attending, you are relaxing the muscles and make them function better. When a muscle functions better, it relaxes, and when the muscle relaxes, pain subsides.
Okay.
I cannot bring in weights when the patient is in pain.
Yes.
Yes.
Yes, I understand.
Yeah, and from here she'll undergo another stage of moist hip, just to moist heat to warm the muscle, relax them more, and some soft tissue manipulations. You call it massage.
Yeah.
We call it soft tissue manipulation.
Okay.
Yes.
So what type of patients do you guys normally have?
We manage several conditions. It's the condition which determines the type of patient to come here. Like, for example, a patient who will benefit here is like an elderly patient who is not able to move body segments on her own or his own. You need some assistance. Listen now, like the pulley is pulling her. Her work is just to pull down. The weight pulls her up. Yeah. So we incorporate activities to encourage the patient to perform an exercise.
Okay.
Than me going there and doing it manually.
Yes.
They get even bored.
Yeah.
Yeah.
Okay.
We have stroke patients. We have post-surgery patients. Patients just from surgery, they are recovering in the recovery stage. We may involve this.
Okay.
Yeah.
That's good.
Yeah.
That's really good. So if I may ask you,
Yes.
why did you choose to become a physiotherapist?
A motivation. Number one, when you finish school, I don't think it's wise to say that you may miss what to do or you may be confused what to choose from the several practices we have.
Yeah.
But I have some people who are physiotherapists, and one of them encouraged me. Yes.
Nice.
Yes, and I took it.
Okay.
Yeah.
So if I may ask, what's the most challenging condition you've handled as a physiotherapist?
Like at Betterstream, what we experience here, because we have equipments which are not existing in our standalone clinics. So patients prefer here because of equipments we have. So you must have the technology to operate the equipment so that it can benefit the patient. So our challenge is we receive chronic cases that have overstayed for long without therapy. That's the only challenge. Yeah, somebody comes with a stroke of over 5 years, 10 years, and they expect because he's here and you have equipment, he'll walk.
Yeah. Wow.
That's the most challenging part. Not that there's a condition that you become funny, no. That's the challenge we have. Like children, you see, you brought a cerebral palsy child which you are supposed to start taking care of after birth, after the incident. But somebody brings you at 4 years, 5 years. What do? It's like you're starting down, going up, and yet you're starting between, not even down. Yeah. So it becomes a challenge that you have to think beyond outside the box and see how fast you can bring the child milestones to where you want, because ameikosa kwa muda.
Okay.
Yeah. So that's the challenges you are having. Chini, mikono juu, mguu juu, mkono chini, mguu chini, mkono juu. Endelea hivyo, mkono chini, mkono chini. Good, mguu juu.
So, Daktari,
Yes.
do you get referrals from assessment centers?
Yeah, all our patients are referred.
Okay.
Yeah, all physiotherapy cases are usually referred from one source or another. But ideally, we have our major partners who are like our major referral partners, like schools with children with disabilities. Like it's called what? It's called, we have a New Life here. Yeah, we have Totally Kids and Sapphire.
Okay.
Those are our major ones. And we have institutions handling like orphanages. Yeah, handling such children. They also refer. Like it's called what? Humanity, whatever in Awasi. Yeah.
Okay.
So we still referred cases. Yeah, some are referred by fellow patients. Some are referred by some doctors in hospitals. Yeah.
Okay.
Yeah.
And so for like this process, what's the treatment plan for it?
Like for her?
Yeah.
Yeah, because she came with some tremors of the hands. You see the right hand? It has still some tremors. And when she came initially, she was having tremors up to the head and perhaps the whole body. Resting and even when doing something.
Okay.
You see now she's exercising, but she's having tremor. Yeah. And slowly, if you monitor, look at the head.
Yes.
Look at the other arm.
Yes.
Yeah, that's what she came with. She could not walk well because of this. She was very slow. Yeah. She could not do any activity because the hands remain like this. But we are happy after a few sessions of 2 months, she's independent, she can climb stairs, can do her work at home. The tremors have reduced. They come occasionally.
Okay.
Yeah. So she's a case that purely such a tremors occur in patients who have a condition we call Parkinson's disease. That's just involves degeneration of the brain cells at some stage in life. Usually it gets affects persons over 85 years, but of late we get it even in 50s, 60s. Usually it was like associated with men only, but now the female rate is high. Yeah, but she has not been diagnosed for that.
Okay.
Yeah, nothing has shown such a diagnosis. So we are treating because of other conditions she has.
Okay.
Yeah. Ours is just to restore joint mobility and function, body function. Yeah. Yeah, that's our plan. Yeah, so she's doing well.
Yeah, she's doing good.
Yeah, she's
doing
well.
good. She's doing good. So what's your parting shot?
My parting shot is that people need help, people need such therapies, and the problem with us is that our people don't seek for the services. They wait until late. Some conditions can be controlled early in life, but you just live a normal life without a lot of strains. Yeah.
Okay, Doctor. So would you kindly explain to us the equipments that you use for physiotherapy?
Yeah, this is a section of physiotherapy department for exercise therapy.
Yeah.
Yeah, we have exercise therapy room. We have, we don't call it a gym for purposes of therapeutic exercises. So in exercise therapy room, we have this one. Some people call it a tilt bed.
Yeah.
We call it a tilt board. You find a patient perhaps has no strength in the lower limbs that can support him or her upright in standing without manual support. And we want this patient to bear weight on the limbs equally and have that postural sense like in standing. We just place the patient here, head on that side and legs stepping here. We fasten the knees, the waist and the chest on this bed. We tie the patient and then we just tilt the board. The patient will find himself standing. Yeah, so you have some cases of paralysis, some cases of weakness in the lower limbs, some cases of spinal cord injuries, which present with such a case, or even long bed rest, or in the elderly who have not walked for some period. So this one helps us for a patient, to support a patient in standing.
Wow.
Kama hawezi fanya mwenyewe.
Okay.
Yeah, and it stands you at 90 degrees. But we go in sections. You can stop there after a few minutes for the purposes of blood pressure. Some you bring them directly, they'll be so dizzy. So yeah, so we put it in stages. So it goes up to there. Good. And now you have your patient
Like that.
fastened.
Wow.
Legs supported well, the chest.
And then you tie with the belt.
Yeah, we have the belts for the
Okay.
knee, the waist, and the chest. So the patient remains upright. We use a mirror for posture correction.
Okay.
Yeah,
And so,
yeah.
and then this.
Yeah, this, I'll remove this. It's not part of it. These are called medicine balls. Medicine balls are used whenever we need patient to perform some weight lifting exercises or even an activity involving some weight.
Okay.
We use medicine balls. They are from 1 kg to 10.
Okay.
Yeah. So next time you come, I'll give you a patient and you see how we use medicine balls.
Okay.
They can even be used in the pitch for patients post-surgery, knee injuries. You know, hitting against a heavy object helps a lot in sports, strengthening the muscles and even the tendons and ligaments.
Wow.
Yeah.
Good. So the next one we have is this.
Yeah.
And also the weight lift.
Those are called dumbbells.
Dumbbells.
Dumbbells are used for various types of exercise that require lifting weight.
Yeah.
Yeah, we have a bench even for that. Patient can lie down and do this. Patient can sit or stand, depending on how you have framed your activity. Can even use a mat.
Yeah.
And we use dumbbells.
Okay.
Yeah. And then we have this one. This is called a quadriceps exerciser. Yeah, some people call it a leg exerciser. So in this one, it's meant to strengthen the quadriceps, the thigh muscles.
Okay.
Yeah, thigh muscles are meant for walking. So if a patient comes with weak thigh muscles or a painful injury that is recovering, or it was stiff, but now we are looking for movement, we have gotten the movement, we want to strengthen it. I'll put the patient here like this. If I'm working on the left leg,
Okay.
he'll be lifting against a weight.
Okay.
So I regulate weight according to the patient ability to lift.
Nice.
Yeah, if he's very weak, I can put 1 kg or a half. As I increase as the patient progresses. So with the time you'll find the quadriceps becomes strong. We also have for biceps, for what? It's a machine that can work on all parts of the body.
Okay.
It's adjustable. Even your patient can do it in lying if you want. Yeah.
Okay.
This is a new technology. This one is called Anway Mobility Trainer. It's written down here. It's like a hoist. It's remotely controlled. Actually, it's the one using this belt. Yeah, so assuming you are a patient who cannot stand because of one reason or another, and we want you upright, and we want you to make a few steps, or we even want you to use a treadmill. Yeah, I can simply put you here, and it goes down. It goes down. Yeah, I can bring it down, and I've tied you well. You are here. Yeah, this comes across your lower back. This one comes across inside your thighs. It lifts you and holds you well. You can use your arms to support yourselves. Yeah, and then we make steps. Yeah, and then I can even lift you up if I want.
Okay. It cannot.
Yeah, I lift you so that you balance. I can, if I want a lot of weight, I bring you down so that you step. Yeah, it's a very good one.
Okay.
And I'll send you some photos on your number, which we captured on this, so that you can understand. And then I move it with you, so that when you walk, we go, you make a few steps. Yeah, I can even put you on a treadmill so that you run on it. So it's called an way mobility trainer. It trains a patient. It's a new technology on the market.
Wow.
Yeah.
So it's a good one.
Yeah, it's a good one. It helps a lot.
Wow.
Yeah, this for back exercises. Dumps when you're using the weights. It's called a bench, an exercise bench. Yeah. You know how it is used?
Yeah, you lie.
Yeah, you lie on your back, and then you can use parallel bar. Parallel bar is just used in training a patient to walk. You find a patient from wheelchair, you want now to start walking. Pengine alikuwa na fracture, ikafanyiwa nini operation on the knee, weakness lower limb, but this patient is strong enough to
walk.
Yeah, so you can support himself while walking. Yeah, but you always will use a mirror so that patient can see, am I upright, am I bending? You tell the patient, patient sees whatever he's doing. Yeah, so it's just a parallel bar to support the patient, to train mobility and posture.
Good.
Yeah, get posture. And we can also use it, like I want to train balance. This is a balancing board. Yeah, it rotates that. So a patient has poor balance. Ukimwambia afanye hivi, cannot do. Ukimwambia afanye hivi, cannot do. He will do a lot of things to achieve that. But when you are training balance, this is a patient who is falling anyhowly. But now you want the patient to be able to coordinate the two limbs and balance well. You can use it here.
Wow.
Yeah, you can use a lot of here on the parallel bar, so long as it provides protection to the patient where to hold. Yeah.
Okay.
This one is a wall bar. It's called a climbing bar. Used in several forms of exercises.
Okay.
Yeah. For example, you have a problem with your knees. Perhaps they were stiff or weak. So I simply tell you to hold here, climb here if you can. And then squat. You know, I'm working on your knees. At the same time, your knees are bearing your weight. They're carrying you up and down. You see where my hands are. They started up, but I'm down. When you reach here, you'll find a patient cannot even come up. But continuously, repeatedly, it creates strength and mobility in the knee.
Wow.
You can even use for stretching. For example, stand there. Just stand here and face me. Face me. Good. Hold here with your right hand here.
There. Here.
Good. You are tall. I'll increase. It's a stretch. A stretch you have to reach.
Okay.
Yeah, you don't just hold it. You have to reach. Now stand here and face me. Good. Hold mbele kidogo, and then hold behind it. No, look at me. Face me.
Okay.
Good. This one holds behind. You see, you are stretching. Tell me if you are not stretched. Tell me if you are not stretched. And I'll challenge you. Bring this leg here. In that position.
Okay.
Umewacha. Shika, I want you to feel it. No, behind your head. It has to come. Hey, good.
Oh my God. Hi, Daktari.
Hi,
What's your name?
I'm Jefferson Burudi. I'm a physiotherapist here at Betterstream.
Okay.
Yeah.
So we are seeing machines, and would you kindly explain to our viewers who might not be aware what this is and what it helps?
This is a treadmill.
Yeah.
It is used to train for cardiorespiratory system, where we strengthen the cardio. We'll also use it to warm up the muscles before we start any other exercises.
Okay.
Yeah.
So it's basically for muscles.
It's for cardio.
Cardio.
Cardiorespiratory system. We train for endurance.
Nice.
Yeah.
All right.
And also it is used to warm up the muscles. Yeah, before we begin any other exercises like stretching. Yeah.
Okay. Can someone with arthritis be on the machine?
Yeah.
Okay.
Yeah.
And that's good. So it also helps to relieve nerve pains, sort of. Does
Yeah.
it?
Mostly when we use it, as the patient walks, there are certain things it's achieving. First of all, we have joint range of motion of the lower limbs. Yeah, because as he moves, you can see that the joints, that is the knees, the ankle joints, are also in movement. So, and also it helps to stretch the muscles because when you move, you're stretching the muscles. So it
Yeah.
helps to relieve something.
All right.
Yeah.
Thank you so much. And so guys, I hope you've learned so much the way I have. So if you have a patient or a kid or just anybody that you know that has CP or autism or any type of disability that requires a physiotherapist attention, kindly seek Betterstream. They have the best physiotherapists and occupational therapists so far. And so that has been it, guys. If you're a new subscriber, kindly hit the subscribe button. If you're a returning subscriber, thank you so much for watching this video up to the end. And that has been it. Bye bye.